Hi, this is Arshad Khanani from Sarah Associates. Now I'm back in clinic and reflecting on the learnings from the AAO meeting that I attended recently. I am thinking about the things I've changed in my practice or learnings I've introduced into my practice after attending the retina subspecialty day. I think few things to highlight from my standpoint has been extension of patients with neovascular AMD who have no active disease and have no fluid. This goes back to the talk by Dr. Barbara Blotti about incidence of macular atrophy in patients treated with anti-VEGFs compared to no treatment in the Marina study. Obviously, I've been already doing treat and extend in my treatment regimen, where I extend the patients as far as I can before the reactivation of disease or recurrence of fluid. But I think now what I'm trying to do is patients who have been stable on the same regimen for a long time, I'm trying to use the latest treatment options to see if I can even extend those patients longer. In terms of looking at fibrosis, I think that's something as a field we need to come up with imaging modalities and biomarkers for. And what I'm personally looking is in terms of OCT, I'm evaluating the biomarkers for fibrosis and also looking at visual acuity correlation. This goes back to Dr. Usha Chakravarti's talk about fibrosis. And lastly, the talk by Dr. Jamie Chung on PCV, and sometimes we need combination treatment if we are using the strongest agents and we still have active disease. So considering the number of PCV patients are, not very high in my practice, but I'm specifically paying attention to those patients and to see if they're not responding to the latest and the most potent treatments in my clinic, then I am considering combination therapy with PDT in those patients. And lastly, I want to highlight the talk that I gave at AAO in terms of fellow eye dosing in patients with neovascular AMD with ABBV-RGX-314. As you recall, I presented the results of bilateral dosing in the fellow eye, and this is the first time as a field we have, dosed both eyes with gene therapy. And I think it's a milestone in that sense that we have patients with neovascular AMD, and many of those patients have bilateral disease. We already have data on ABBV-RGX-314 in terms of 4 years of durability and treatment effect. And the data I presented showed that we were able to reduce the treatment burden by 97% in the patients that received the fellow eye dosing, and 78% of them did not require any supplemental treatment till 9 months. And obviously, we did not see any new safety signals. So showing that subretinal gene therapy with ABBV-RGX-314 is safe and efficacious in patients with neovascular AMD. I'm very active in the clinical trial space with many gene therapy trials, specifically ABBV-RGX-314 for neovascular AMD, as that program is in the pivotal stages with phase 3 Atmosphere and Ascent studies currently enrolling. So I think the data I presented gives hope to patients who have participated in gene therapy trials and have done well. Their fellow eyes continue to receive injections, and hopefully in the future they will be eligible to get treatment for their fellow eye with ABBV-RGX-314. So very exciting times for us as a field, and lots of new things coming up in the future. And of course, the AAO subspecialty day was very helpful in terms of learning new things and, of course, implementing them in clinical practice. Thank you for your attention.